you that I've been sitting on the POMES committees, and this has been very, we've learned a lot together, so I'm excited that Missouri's doing this. Thank you, Rose.
Thank you, Karen. And Scott, I see you're on the line. Scott, can you introduce yourself?
Hey, good morning. My name is Scott Lopez with Alliance Rehab and Medical Equipment, and looking forward to networking with the group this morning. I'm going to be on and off mute because I do have an eval I'm getting ready to do, but I'm going to try to listen in as I go. So, I look forward to hearing the information. MAMES does a great job helping our teams across the MAMES network. So thanks, Rose, for all you do.
Thank you, Scott. Appreciate that. And Scott works alongside with Karen. He's our Missouri board member. We are missing Pat Nager. He's also a Missouri board member and a MAMES past president and our legislative chair. So hopefully maybe he'll jump on as well. But then I'll go around the horn according to my screen. And John Gallagher, I think everybody knows you, but go ahead and introduce yourself.
Well, hello, Missouri. John Gallagher with VGM. I'm just going to listen and take notes. I've gotten some great information from the other ones that Rose has done. Hopefully we can go back and take a look at where VGM can be helpful.
Thank you, John. And how about you, Dan?
Morning, everybody. My name is Dan Lipinskis. I'm with LifeTech. We're a complex respiratory care company. Trying to get more involved with MAMES. It's been a great couple of weeks. I know I participated in the leadership committee for the first time. I think that was last week, and been participating in the legislative committee. Looking forward to this session and find out how we can all work together. Thanks, Rose.
Awesome. Thanks, Dan. And Craig, you're up next.
Craig Douglas, Vice President of Payer Relations for VGM. I've sat in on several of these now in the various states that MAMES represents. Been great conversation in every single one of them, not necessarily the same conversation, different topics in different states, but all very good. I think everybody's left with, feeling good about the conversation and learned something. So I'm looking forward to doing that again today.
Awesome. Thanks, Greg. And Adam, you're up next.
Hey, good morning. Adam Smarecki, BJC Home Medical Equipment on the Missouri side. This is my first meeting since I've been here. I've been here about a year now. Some of you might know me from Wisconsin, so I'm here now.
Yeah, well, we're glad to have you on board there, Adam. Appreciate you joining.
Of course.
All right, Mike Henry.
Hey, good morning, everyone. Mike Henry with AeroCare in Missouri. I'm the regional manager for the western half of Missouri, and glad to be part of this meeting, and look forward to seeing what everybody has to say.
Awesome. We're glad to have you too, Mike. Thanks for joining. And then we've got Mark H. Mark, or if you're talking, you're on mute. Or maybe Mark can't talk. I know we've had some issues with folks. They join on their computer, but they don't realize they do not have voice capability. I don't have it on my hard computer, so that's why I'm using my laptop. So if you are on your computer and you want to be able to talk, you can dial in on the phone number that was listed in your appointment request, and then you can speak up. And I believe CT Walker, you're up next.
I'm sorry, I just joined. Are we just doing introductions?
Yeah, we're just doing introductions just so everybody knows who we're talking to.
All right. Well, I am the director for Freeman Health Essentials in Joplin and Pink Door Boutique, which is a women's health location that we have certified mastectomy fitters, and obviously do mastectomy and forms, and just recently started doing custom breast prosthetics through Radiant Imaging, which is pretty cool. So at Health Essentials, we do just about everything that you can do in home care. We do ventilators, we have an ATP, so we do complex rehab. Then we've got a pretty good retail area. We do a lot of retail sales. It's pretty big storefront with lots of products out on the floor. So that's what we do here. I'm a respiratory therapist and a certified orthotic fitter, and I've been in DME for almost 26 years.
Awesome. Refresh my memory where you came from previously.
Well, I came from NMC, if anybody remembers National Medical Care. They were owned by W.R. Grace, and that was in the mid-90s, and I transferred with them to Orlando, Florida, and worked for them for 7 years. They ended up being bought. Lincare bought most of the locations. The ones in Florida and California were bought by Life Care Solutions, which I'm not sure if they're still around or not. And then I went to work for Apria, and then I went to work for Cox Health. I moved back to Missouri in 2006, and I worked there for about 10 years before coming here at Freeman.
Awesome. Well, we're glad to have you and glad to finally hook up with your voice.
Yeah.
We've communicated multiple times via email, so glad to have you on board.
Yes. Thank
Good.
you.
So this is the portion of the meeting. I'm just going to turn it over to you guys. The goal for me is not to talk much, but this is your opportunity to network back and forth, as Karen is very good with networking. So yeah, this is your opportunity to, discuss any questions you have of each other and let her rip.
That's a nice way of calling me a yacker. Does anybody have some questions on what's going on with your companies? I've been on a lot of these calls with Rose and some other members. Anybody running into not being able to get PPE? I know we're having a problem trying to find N95 masks right now. I've got N94 that are certified medical, so we've been showing those letters when we're going to facilities. Most of them have taken them if we got to bring our own. Got an email from them. Go ahead, I'm sorry.
I was just going to say at Freeman, we really, believe it or not, we're part of a hospital system here, and we're owned by Freeman Health System. And believe it or not, the gal that's in charge of all the PPE for the hospital system has reached out to me for resources because she was having a hard time. And through VGM and the discussion boards, I've been able to actually hook her up with folks to supply the hospital with different PPE products.
Do you know what vendors you guys have found them from?
Yeah. Yep, I can, I'd have to look it up on the emails, but this started about 3 months ago, and I talked to her 2 weeks ago, and she was still using 2 of those vendors.
Okay, I'd love that information if you got it, because I had somebody reach out to me, and it was like, and I understand, right? That's their job. But it's like 4 masks or 5 masks was going to cost me $20.
Yeah, and that's the other thing. I mean, they're obviously very particular about the cost, and we screened through probably 4 or 5 different vendors before landing on 2 of them. We had different products. One vendor couldn't provide one of I think it was gowns or something like that. So we had to go to another provider for the gowns, but the pricing was good on it. So I'll send that to you.
Was Mazda one of them by chance? Does that name ring a bell?
Who is it?
Mazda Healthcare?
No, that doesn't ring a bell.
Okay. And you're going straight to a vendor. You're not going to another provider who has some extras, right? Yeah, you mentioned those discussion boards, and I know there's a lot of that. Like, hey, I'm out of masks. I can't get any from my regular vendors. Does anybody have any to spare? But you're actually getting them from a vendor, right? Not from another provider.
I think one of them is another provider. Let me see if I can find that real quick.
Because I know the N94s that are certified are so flipping tight on my face, I'm going to have scars on my cheeks soon.
Let's see.
while we're kind of waiting, is anybody running into access issues, like not being able to get into skilled facilities because you're waiting on testing? Is it delaying your drivers? How are you guys handling that?
Well, lucky for us, being a part of BJC, all of my technicians and therapists fill out their health check in the morning, and it goes through the entire system. So we walk in and look fine. So it's, if you look at it from that perspective, that's great. But at the same time, our volume is really spiked so much that, we're taking on all of it because of the access issues for other companies to come in. And it's at the point now where, I may have to partner with somebody to handle some of the volume, but we're doing our best to do it now. I mean, I've got PTAs out there making deliveries for us right now.
So will they take, if you go into a facility or your facility's letting you bring in your own, since I bought all these tests to test inside of our out, and one of my employees I think has it, they can go to their car and I'll have it test and results in 5 minutes. Will they take those tests that your company's running?
They probably, if it's us, it's fine because we're actually in the system of BJC employee. But our facilities are doing temp checks for anybody that walks in. It doesn't cost anything.
It's a nasal swab that we're running into. You have to do them, and then our drivers are waiting 20 to 30 minutes to get tested. And so we're eating. If we're in 2 nursing homes that day, we're an hour and a half just waiting on tests right now.
Yeah, that's we're not
that's
having
part of it. I just thought if I had my own test, would they accept it, showing, hey, here's the negative? I haven't tried it yet. I was just wanting some feedback if anybody's tried that.
Yeah, to be honest with you, some of the, even though we're BJC and some of the facilities are, partners with BJC, they're not even letting us in with some of our own testing that we've done in the system. And I can walk into the hospital with it, but I can't walk into a sniff with it. They're asking us to put equipment outside. It's just, I'm going, we're not doing that. I'm not putting a heavy duty bed outside. Who's going to carry it in? So
Right.
We're running into that kind of, it's crazy. It's crazy, but it's a strange role right now because it depends on the hospital, depends on the skilled, it depends on, if it's a hospice or not. I mean, it's just been around the board. So I've just instructed my guys, just, you've got to do your health check here. You've got your temperature done, and that's got to be the truth.
So when they ask you to leave that equipment outside, are they saying that their staff is going to try to set it up?
Yes, they are.
I assume that raises some concerns for you.
It does. We've been asked that several times. It's only happened once where a technician just didn't know the right answer.
Yeah.
And it's never happened again. I said, too much of a risk there. I said,
absolutely. That falls back on you.
Oh yeah. These low boy beds, things like that.
Yep.
No way. So it's become an issue, especially for, patients that need to get out, need to go back to a skilled, and they're delaying in a hospital, and then that doesn't free up the bed in time. So it's been a real conversation top down to understand that, we are a home medical equipment company, but we are affiliated with BJC. You got to remember that, so it's been interesting. We've been able to deal with it in different ways.
Now, why won't they accept your own systems test? That's so bizarre.
Well, if a facility is not affiliated with us,
okay,
they'll want to do their own testing. Or if the test was done in the morning and it was rapid and it didn't incubate long enough for them, for their idea of what it should be, that's why they'll say, we don't want you in yet. Much like, I can't have these gentlemen and ladies sit in their cars for 45 minutes for this test to come back. Our spike, I'll be honest with you. My COVID census for oxygen for me is over 700.
Oh my gosh.
We're doing, our run rate is 50 to 80 a day.
Oh my gosh.
So we've more or less stopped business outside of oxygen setups. We're working 12 for sure. We're pulling, like I said, we're pulling PTAs in to help us out. I've got folks that, were previously furloughed that came back just to enter tickets for us. We've got tanks all over the place. I got runners everywhere. It's, for us, we're in our second surge in this area, Greater St. Louis.
Now, how are you keeping up with equipment, with concentrators and stuff?
So during our first surge, when this first hit, I went crazy and bought a lot.
Oh, okay.
And just, when I say a lot more than I think I've ever bought in my career with a course of 5 years, we just went nuts. And it came down to it, just to be predictive. I said, we got to hang on to this. I'm not going to send these orders back. We got lucky before we started having issues, with overseas getting things here. We overstocked and we still have it. I mean, we're using 3 different companies for tanks in general to fill and to purchase from. But you know, we're turning tanks around all day, you know, just by those numbers. I mean, it's crazy. I mean, we're getting delivered 24 hours, you know, turnaround time. I'm putting out 330 a day. There's no doubt.
What's the leader flow you're seeing most often on those?
So from a percentage perspective, you know, really it's about, I want to say about 20% or above 4.
Yeah.
You know, it's not that high, but you know, 20% of the 700 were above 4. You know, we're also seeing folks that are, you know, between 2 and 4 liters are going home. It's a PRN. We know that we don't have to have everything we normally would as far as testing goes.
Yep.
And a lot of those folks get picked up within 4 days.
Yes.
The interesting thing we're finding though is patients want it out of their home before they're discharged from it. And that becomes a real, those folks argue with us. So we do need a discharge order. I mean, that's what needs to happen. When you've got hospitalists and ICU docs sending people home that aren't following them, who are they going to get it from? So I've got a ton of these, you know, AMA patients right now that just want it out of their homes. And it's just been straight. And plus keeping up with the pickups on top of that, it's interesting. But at least I know where my equipment is. I can go get it. So
yeah.
Well, and then the cleaning side of things too. You know,
3-day turnaround and it comes back.
Yeah.
Yeah, we this is Mike in Columbia, my office with the university. I mean, we're one of their primary providers, and we're just scattered all over the place. And fortunately, you know, university's pulling people from all over the state, and you know, we're setting up tanks left and right, and one right after another, and concentrators. You know, I'm fortunate enough, I've got 10 locations that I can pull from. So I can pull oxygen from other locations. And we really haven't had too much trouble with that. But we also have kind of a crazy policy that I've been questioning, but, you know, that we're isolating or quarantining our equipment for 7 days after we pick it up if it's a COVID positive. And you know, I question that. I question that because everything I've read is if it's appropriately cleaned, processed, and so on, it should be good to go. But you know, I'm not the holder of the gold, so you know, others make that decision. So so that's our challenge. I would tell you, Adam, I mean, just here in mid-Missouri, and of course you have still have Boone, right?
Yep, we still have Boone and the Farmington area as well.
And Kevin, I know Kevin very well. He used to work for me, but good guy, and I'm sure he's running his tail off too because
it's crazy. We're running. We're sending him help all the time now, as we have to. You know, and of course with Kevin, the majority of the folks that leave because of the distances, they're getting portable concentrators to go home with before we can deliver back out. So keeping up with that stock in general, we're able to do it, but it's a different world when it's COVID and it's a turnaround so quick most of the time. You know, and these patients are getting portable concentrators. You know, in most cases, they've got that longer than they have a standard anyway because of the distances. So.
Yeah, and I would agree. The other challenge is that we're having is the, you know, they're contacting us and say, come and get it. I don't need it. Get it now. And we just tell them we need an order. And we've just accepted the fact, as long as they agree to an AMA, we just move on. In reality, I mean, you know, I would venture to guess 75% of them no longer really need it. But there's still that 25% that still may need that oxygen. And for other chronic underlying diseases. So, you know, it's you got to weigh that how you're going to be able to handle that in the branch. So I get it. We're dealing with the same things. So.
One of the solutions that we have for a certain population is, you know, the home monitoring system. So we partner with some of the physician groups in our home care that's got telemonitoring. And patients are going home from specific, safety net hospitals with pulse oximeters and thermometers. If they don't have like a MyChart account as a patient, they have that. Then we set them up with home monitoring, and we're literally monitoring their oxygen levels and whatnot while they have the equipment, so we can turn it around quicker. It's not every single hospital, but it's where we've got willing physicians to follow these patients. So that happens, and of course that's reduced any of the AMA because they call in every day or they're already monitored, and but there's a cost to that though. I mean, I'm eating the cost on all those things.
Yeah, I was gonna say I'm
gonna get a fair pulse back. Yeah, no. So
yeah,
I
we don't have that.
Yeah. Report that at finance and say, remember all those things I bought? And that's what that is.
Yeah. That's so. Yeah, this is it's become a real challenge to take care of these patients when they go home with these respiratory problems, and I foresee this just. I mean, it's just not getting any better for us right now, and I have somebody at the university just constantly delivering tanks. Now they're asking for consignment situations where we will put some in their warehouse. So we'll see how many we'll see how many tanks lose. They put a nurse in charge of them, so that's the biggest problem.
Yeah, there you go.
So Mike,
Tanks and regulators.
Yeah.
you were quarantining your equipment 7 days. Now there's been lots of conversations on a lot of our other state networking sessions, and there's been a pretty big spectrum of what people are doing. Yesterday there was a hospital-based company. They're doing 5 days. They're doing 5 days quarantine. We had other folks that report they weren't doing any quarantine because they were confident of what they were doing in their cleaning of everything, that all equipment was treated the same. So you guys' thoughts about that? I mean, because that's, I think, the challenge. Everybody's trying to find, follow the CDC guidelines, but it's just, I've just been hearing a lot of different things related to quarantine.
Well, I'm glad you brought that up. I'm glad to hear that we're not the only ones, because if you read the CDC guidelines, and if you read the cleaning, the disinfectants that are out there and are available and things like that, if they're appropriately cleaned, I would assume filters are changed on concentrators and so on, that there should be good to go. As long as we're using the appropriate disinfectant, I can't think off the top of my head, meticides and things like that. But that's the question: is can you really get to everything on the piece of equipment? And are you properly cleaning it? Is everybody properly cleaning it in between patients and so on? And I think that's why we as a company have decided to go with 7 days. Whether what's appropriate, I don't know. Are you guys, what are you doing, everybody else doing with their equipment? Are they turning it around right away?
Yeah, I'm with Rose. I've been on several of these in many states, and I think, yeah, it ranges from 0 days, meaning, yeah, they just do their normal cleaning process, and there's no quarantine period. They just clean it, and it goes back into the rotation. And I think there was one company maybe that said 14 days is what they were quarantining the equipment, the concentrators specifically. So just one other thought, and I don't know that it came up on any of these calls. Rose, you can tell me whether you've heard it too or not. I think it came up somewhere else, but they keep track of which concentrators were out for COVID patients. That way, if they won't give that to somebody who maybe just needs it for COPD and has never been COVID positive, they don't want to run that risk. But if the patient is a COVID patient and you're putting out a concentrator that's already been on a COVID patient, the risk, I guess, they feel is a little more minimized. So they're keeping track of which ones were out and putting the COVID ones out for COVID patients and kind of keeping the other ones for the other needs for oxygen. Was that on one of these calls, Rose, or was that somewhere else that I heard that?
Yeah, I don't recall that one.
Okay.
And that's
Yeah.
interesting. We're doing something similar with that. Of course, we're
Okay.
keeping track of our census, but we are quarantining right now for 3 days. And we came up with the 3 days because we worked with our risk management team on that. We've had several in-services with our folks at Clean on how to do it. We do spot checks and all those types of things. 3 days is the max that I think that we can afford just based on the amount of inventory. And we are doing our best to separate the two, but we run into the fact that, in some cases, these patients are discharged and all of a sudden a COVID positive test doesn't end up in Epic in the AVS, or we have no idea. So it's with that risk rate, that error rate there, we're pretty much just cleaning everything. I mean, that's how it goes. Depending on the demographics too. I mean, some parts of St. Louis are, higher than others. And if I'm out in Farmington, there could be days that we have 0. So it's different.
Mhm. Mhm.
We're doing Freeman a 3-day quarantine as well with our equipment, and that's based off of one place is Invacare with what they published. We use their products for O2. We rented a pod unit, put it out back, and that's kind of our quarantine area.
A storage pod, one of those.
Mm-hmm.
Yep. Okay.
Yeah, actual pod.
Yep.
PODS is the name of the company, pod. And it's cheap. It's
a couple of them do that.
Interesting.
But I'm running into issues with getting concentrators now.
Yeah, you're not alone there. I mean,
Yeah, we're all, I think I saw a report, 2-week delay from some of our manufacturers, but I've heard others that it's even longer than that. So it's, it's hard. They're hard to get, and we in the past were, some of our concentrators, when they're out of warranty and spending, a couple $100 on repairing them, we were at a point we were just cutting the cords on them, but we're not doing that anymore.
Mm-hmm.
We're getting them repaired as quickly as we possibly can, so we can turn them back around. So
yeah.
Jackson, and I see that you're on the line. I know that Jackson Meister from McKesson is on the line, and I know that they had some access to concentrators. I don't know if that's still the case or if they're all gone.
Yeah.
Hi,
Hey,
Rose.
good
This
morning.
is actually Alex with. Oh,
Go ahead, Alec.
Jackson, I didn't realize you were on the line too. Right on.
No, go ahead, Alec. You're good.
Yeah, cool. Thanks, Jackson. Rose, this is actually Alex Buffner. I'm the account manager with McKesson in Missouri. I actually live in St. Louis. If there's any concentrator needs, we do have the Drive 525DS stocked. We're sitting on just over 1,000 of them in current inventory, ready to ship immediately. And we are expecting more inventory landing in the next couple weeks as well.
Very good. Thank you.
Everybody have Alex's contact information, or Jackson?
Hey, Jackson, do you guys also do, or the other dude, do you guys also do, sorry, guy, do you guys also do manual chairs? Because we're getting delayed on getting our manual chairs in.
Hey,
For
Karen, good morning.
manual chairs, you guys, I'll go for it,
Manual
Jackson.
wheelchairs, bent metal.
Yeah, Karen, we definitely have bent metal. You guys doing Drive for the most part? Do you have
Is anybody from Drive on the phone?
not that I know of, no.
No. No. So if that's what I had too many. When they first came out, we had 14 wheelchairs and about 10 of them broke, and so I won't order them. That's when they started. I just gotta, once you get that bad of a run, we just weren't gonna do it again. They're coming, but we're going through them so quick. I just need another source in case we can't keep up. Right now we use Invicares, but 7-10 days is what we're looking at.
Yeah, as you know, Karen, we carry just about everything under the sun. I would hate to tell you no before at least double checking or confirming. Do you have contact info for me? If otherwise, I can shoot it to Rose to forward over to you if you want.
That'd be great.
Perfect.
And
Let's
then
start there and we can confirm.
Okay. And then I don't know if anybody on here is in the rehab world. Backs and cushions from Comfort Company are really delayed right now. I can get a full-blown power chair shipped to me in 5 days, and we're waiting about 10 to 12 days on backs and cushions after my chairs are dropping.
Wow.
They are really delayed right now to the point where I'm pulling orders, and even if we've ordered their back and cushion, I'm trying to find a Pride shipping quicker. About eBay is, they're just having some issues. I don't know, maybe it's UPS right now, but I'm switching out cushions, stopping orders. It's kind of a nightmare right now to get everybody's deductible met by the end of the year.
I certainly can't think of a reason for a huge spike in demand for those. Did they back off on staffing or?
I don't know. I haven't called him yet. Bill just alerted me yesterday. We got to do something. We've got, is one of my patients' chairs, how it came up. I'm like, why is this chair still sitting here? And they're like, we can't get backs and cushions in. I'm like, what? Why? Where's the alert to the owner? So
you want me to talk to Greg about that or?
No, that's all right. I got it handled.
All right.
Already put a text through this morning. Not told Greggy, but the nice thing about Comfort Company, I didn't realize it was a problem. Normally my rep will pull everything he can to help. I mean, I haven't pulled it yet, but we do know that's becoming an issue. And somebody came in the other day, competitor, I forgot who it was, picked up a chair from us from like Pride or something. I don't know, but they just said they're having the same problem. So it could be UPS. I mean, UPS is already sending out alerts. If you don't order Christmas by the 12th, you're not getting it. So I think some of it's that, I don't know. I also want to bring up a point, or I'm going to forget this with the way I squirrel around. We have had 3 Medicare denials, and I've never seen this, and we really all need to watch this on our high-end power chairs because the telehealth the doctors put down, they were audio only and not visual. So we had $40,000 in chairs denied. And so we actually have found a telehealth doctor we've been using, and he's doing great. The problem is Missouri Medicaid requires that doctor having an NPI inside the state, and it's going to take him 90 days to get his NPI active in Missouri. So we're kind of stuck there. I sent something to Medicaid yesterday saying if I use a telehealth doctor for the Medicare portion, can I have a Medicaid doctor sign off on the face-to-face, and will you accept that? I'm waiting because I made them send it to the fraud unit, so they have to give me an answer to make sure I'm legal.
Yep.
That's my only backup plan, but really watch us. We never, we're not looking at chart notes going, does this show audio too, and visual? So if anybody here besides myself is on high-end rehab, watch it, because they are watching it like a hawk on prior auths.
So they're already doing audits on dates of service within the.
I'm sorry, it's prior approval. I say audit. It's when we go in for our 10-day prior approval on our custom chairs.
Okay.
Sorry about that. Yeah. It's K5s. They're watching it, so it's just something I don't think any of us ever think about. And all of a sudden, it's became a real problem because I've got people that, thank God, I found a telehealth doctor, but again, when you got Missouri Medicaid as a backup, 20% is gone. I have group homes. I have a guy who has 40 group homes waiting for me because they can't get their patients to the doctors. They're in small towns. Those hometown doctors are not doing audio, recordings. They don't have, even though I don't understand that, you have FaceTime. How about you push it? But anyway, the hometown doctors can't seem to figure out the electronics behind it. And these patients, I can't use them because I know they're not going to be able to record it, and they can't get anywhere, and all the group homes are infected.
And they still use paper charts there too. So
right. So I've got a killer. I got 4 doctors to choose from this group I found for telehealth, the problem is that they're not Medicaid. So I'll let you guys know if Medicaid's going to pass that, because I definitely got it in writing. I'm waiting on a response, and maybe we can do that as a special COVID deal for now. They're pretty open stuff.
Yeah, and with that, it's kind of interesting, Karen. In a meeting yesterday, one of our folks said they had gotten an audit during, it was a data service within the PHE, and they were getting pushed back about the signature because it was a COVID patient and they wrote on COVID on the paperwork, and they were getting pushed back. And nobody else, I haven't heard from anybody else. So they were going to look into it further and let me know, but just a heads up about that too, because they're not supposed to be doing audits.
One thing we do on I always tell my delivery drivers, if the patient's not signing, I don't care if it's a therapist, you put relationship to, that's legal. You put relationship to and date it and put due to COVID-19, patient can't sign. I mean, but I haven't heard that back on the kickback. I do know that they're watching those signatures on the SWOs to make sure it's the doctors filling them out for the power chairs. Because, the nurses fill out the top. No matter how many times you tell them they can't, they don't listen. But I did enjoy telling their doctor their entire file failed because I told you couldn't do that. And it's kind of fun yesterday making that call to that doc.
And on a sidebar note, I did send everybody Alex's contact information if you're looking for some of those.
Thank you.
So it's in your chat function.
I have a question about how are you guys handling your employees? So what I have learned through our POMS meeting was if it's under 500, right, you sent me that state law, we got to pay for their time off while they have COVID. Correct, Rose? You sent it to me twice. I haven't got a chance to read because I haven't ran into it yet, but I'm ready when it is because I got your article.
Oh,
but they said under 500 employees is what POMS was saying the other day. You had to pay for
Yes.
COVID time off, right?
Yep.
Right?
Yep.
So what happens when somebody comes in and says, hey, I went over and saw my dad, I've been exposed. You pay for the time they're off to get that test. And
Yeah, they have to be seeking a diagnosis. If they feel like they've been exposed, they have to be actively seeking a diagnosis
Yeah, I want
to
them out.
confirm that.
Yeah.
Yep.
And I tell them they have to wait. Right now, it's happened to us twice so far. We've all cleared. I'm like, you have to at least wait 5 days. This virus, there's so many negatives. I don't care if I pay your extra 5 days, work from home, don't work. I really don't care. I just don't need you in my building.
Yep. And you as the employer get a tax credit for that.
What? I don't know that.
For that time off. Yeah, that's through the end of the year. And that's all through the Families First Coronavirus Response Act, one of the first pieces of legislation that passed when this all hit. Yeah, you get a tax credit for that time off. So they meet all of the criteria for why they're off. I mean, they can't just say, I get 2 weeks paid off, so I'm going to take that.
I'm going to tell you guys one thing that's great if you're a Facebook. If your employees make you their Facebook friend and you tell me on a Monday you think you have COVID, but you're beer bonging Sunday on Facebook and I'm your friend and I watch you do it, you might not want to lie to your employer that you think you got COVID exposed because you're probably fired the next day.
Yeah, bye-bye.
You're gone. So just a little tip, Facebook can work on your favor if you need to when you have a consistent liar lying to you. So we pay it right. Is it most companies making their patients? How long are you making your employees if they think they've been exposed before you're having them test? Are you having them do it immediately or are you making them wait a little incubation period?
We're doing it immediately.
That's what I thought most people were doing.
Yeah, they have to actively be going to get it taken care of.
But my question is, and this is where I get a little confused because CDC has changed so much, right? When my son got it, you didn't test for 5 days in July because the virus wasn't going to set in. They told me to wait 5 days. So is that no longer, is CDC changed their mindset on that? Or we're just all employers and need staff? I'm just wondering, has anybody heard if that really incubation period is now you can test that quick, or are we just doing it because we've got employees and we don't have enough employees? I mean, we all have to work.
But I don't know if the CDC really has said.
It had more to do with test availability.
Okay.
Back in July, we're telling wait 5 days before the test availability. Now they've got the test. So
they don't think there was that incubation period anymore if you've been exposed?
No,
Okay.
no. And most folks are directing hospitals or directing, my daughter's in a NICU. If they think they're exposed, they're directed to get tested right away.
Okay. It's good to know. And then it's the new CDC is if you are around someone but you have no symptoms, right? And even if you're positive, is it 7 days? Is that, am I understanding that correctly? I haven't got to dig, right? 7 days. And if you don't test, you wait 10.
Yeah, they changed it from 10 to 7.
Okay. But if you don't test, you're 10. If you're one of these people, I don't want to test, then you're supposed to wait 10, right?
Ooh, I don't know that one.
I mean, I wouldn't let you come back to work unless you tested. I mean, I'm not going to, but I'm just saying, I think there's something about a 10-day, and I didn't really understand the difference.
I hadn't heard that one.
So 7 days, they need to, as long as they're symptom free, from the date they test or from the date they're exposed.
Test.
Okay. Well, if you're testing negative, why wouldn't you let your employee just come back? Are people letting their employees come back, or are you guys holding them for 7 days?
Well, you kind of lost me, Karen, because if you're tested, I thought there was, if you were exposed and you were tested, you had to wait for 3 days in no symptoms.
I haven't had anybody here test positive, so I just like advice. Like if somebody's positive, are you guys making them wait 7 days? If they're negative, are you making them wait at all? I guess is my question.
We're making them wait 3 days.
Even if they're negative, for 7 days to come back?
3 days.
3 days, okay. Negative, and then 3 days is your company rule, right?
Yes.
But positive, 7 days, no symptoms. Okay.
Positive. I think our policy hasn't been updated, but I think it's longer than that. I might have to go back.
Right, 10.
I think it's 10.
I would probably pay for the extra. I mean, I'd rather be safe. Mine's probably going to be 10. I haven't had anybody test positive, knock on flipping wood.
So let me ask you to back up on something you had said earlier about having to, if somebody is out of work, you have to pay them up to $500?
No, your partner with AeroCare, Rick, said that everybody was like talking about, how does their company do it? And he said, your company's not paying for time off. But when they read the law that Rose had sent us on this poem still, when AeroCare dug into it, if you have over 500 employees, you're not required to pay for time off, which we all said, how backwards is that? Somebody with only 10 employees who doesn't have corporate money like that has to pay, but the big dogs with the, I would assume more money, not saying you haven't, doesn't have to pay for their employees off. I mean, it's just ass backwards to me. Sorry.
I agree. I would agree. I mean, I can't disagree with that.
Right. I mean, we were just laughing about how backwards is that the small company of my size has to do it, but the bigger boys don't. And I don't know the rhyme or reason around, but that's what he said. Over 500 is why the bigger companies don't have to pay.
Yeah, and
right,
you qualify for that tax credit, but that doesn't help you from a staffing perspective. Like you're short staffed. If you're a company of 12 people and you've got 4 of them out, that's a big deal.
It's a huge deal. So we have an extra building. Thank God I bought it right before COVID hit, and I keep my ATPs in that building. If they come here, they mask up and they go back over to the other building, because if those 2 ATPs go down, then Bill and I are up, right? We're really trying to stay away from our ATPs. I see them probably 15 minutes a week. We just do a lot of on the phone calls. I can tell you, and I'm not embarrassed to, it was so busy, and since COVID has hit so hard in the last 2 weeks, boy, has it been a slow down in the traffic coming in. The walk-in, because we have retail, a lot of retail, and it's really slowed down in the last about 10 days. And the referrals are starting to slow down because all our outpatient clinics, they're all shutting down surgeries because the hospitals are so booked. So everything we kind of saw for about 3 weeks or 4 weeks in the spring is now we're starting to see it now.
Yeah. Yeah.
I mean, in the auction world, it's probably gangbusters, but for rehab, we're all being affected because of the outpatient clinics not being open.
Yeah.
We did hear there was a increase, and I'm trying to think of which meeting it was, but they were seeing an increase in their retail walk-ins.
Our retail was gangbusters, the best it's been for the last 2 months ever in history. And then just in the last 10 days, and I know it's because there are so many active COVID that I'm sure, knee surgery patients, or elective surgeries. I'm supposed to go and get a kidney stone removed because the procedure didn't work and I'm refusing. I'm like, you wouldn't put me in a COVID hospital. I got to have surgery either way. When it drops, I'll ring you. But until then, I'm not going in there. So people like myself aren't going to risk it. I mean, if it drops, it drops. We'll worry about it then. But I mean, I think there's a lot of people like that, right? Just losing a brother-in-law to COVID. I mean, it really hits home. You don't want to be anywhere near there. So.
Speaking of, because I think that's one of the big things. I mean, people are just experiencing COVID burnout. What are you guys doing? And I'd be interested to hear from Adam and you, Mike, and even Chris. What are you guys doing to handle your morale with people working 24 hours a day? I mean, it sounds insane. So what are you guys trying to do to help to make those people feel special, I guess?
Yeah, so I think we had no idea what it was going to be when this first started, as far as the fear and trying to get into other people's heads and understand what they're fearing. So we've gone, we do in some cases go overboard with, PPE and treat everyone as if they're COVID positive. Some of the guys feel good. We of course had some employees that did contract, COVID and were out for a while and it scared a lot of people. So we have a lot of huddles every morning. We talk about it. We talk about our fears. We talk about what we're thinking about. We have a lot of relaxation exercises and things like that. It's really, I guess it's kind of a hippie thing, but it works. We talk about it. We talk about managing stress. What do we feel fearful of today? What experiences did you have yesterday that you felt may have put you in harm's way? What can we do to help you? I get a lot of calls after hours from my cell phone talking guys down when they're on call, saying, Item, I can't do this anymore. I've got 4 of them right now. They're all in an area I can't see where I am. And I'll meet them out in St. Louis somewhere. There's a lot of that going on. It's not easy. I've heard a lot of, companies talk about, we're having lunches and stuff like that. Lunch doesn't solve any of this. We get lunches all the time. It's not nothing new there. We do have a lot more as far as goals go and some bonuses and things like that for folks when they reach a certain pinnacle. We've got somewhat of a badge of honor. Once you're in customer service, say for your first couple months and you enter your 1,000th order, you got a gift card. I mean, it's one of those things where we're just trying to stay focused on what's in front of us and keep doing it. But I think, myself, I like to remind everybody, we all like to talk about this being the new normal, but I don't appreciate that because this isn't normal. This is not a new normal.
Nope.
So I've kind of gone against the grain as far as that goes and just said, guys, we're going to get through this. We're going to get through it together. And that's really it. I mean, for me, it's just been someone that can listen. I leave my door open. I cancel a lot of meetings just to talk with people. So that's what we're doing.
I love hearing that because I think that's what you're spot on. People just want to be able to talk and have somebody listen and say, you know what, I'm so sorry. There is a light at the end of the tunnel. There will be. Thank you.
I know for us, our employees don't know it yet, but they didn't want to do a Christmas party this year, right? So I have a girl going today to run to get stockings and fill them up, and instead of every year we spend probably $1,500 on a stupid dinner, and so everybody's getting a $150 gift card in their stocking. That way they can spend that money I would have spent for dinner and gives them a little jingle in their pocket that they won't be taxed on. So just trying to do small stuff like that. We're going to surprise them catering lunch one day. We've been, as a small company, I think we all just kind of lean on each other. I mean, you come in the morning and first thing I say is everybody's family doing okay. So you just got to show compassion.
Mm-hmm.
And that's what we're doing in most of our branches is just talking to people, taking time I have my managers talking with people, and they do their morning huddles and showing some concern about them. And company did up their annual holiday bonus since we chose not to do dinners and things like that. And really, I think talking to people is the main thing, as Adam said. I mean, taking time to talk to them and reassure them that this. I'm with him. I'm with Adam. This is not the new norm. God, I hope not, because we can't. I don't know if we can. Our society can take it. And if we're telling people this is the new norm, whew, it's going to be tough to live in this world sometimes. So anyway, I would agree. I mean, that's some of the ways that you can do it. Show them appreciation is the best way. I think. I mean, it's hard to judge also employees. I mean, it's difficult to judge what satisfies them, what makes them happy, and it's not often money, as we all know. And so, I don't know.
Some people are closed off. They don't want to talk about it.
Yeah.
I have one of my really good CSRs. I'm like, how are you doing? She goes, you can just tell by her face. Okay. Come to find out a friend was on event. So I emailed her and said, you okay? She said, my friend's on event. I'm not somebody who likes to talk about it. I said, great. Let you know we're here for you. So I kind of know with her, I do a kind of private thing, because her personality is different than mine.
Yeah. Well, and again, it's challenging world more than anything. And I do see we're almost at the hour here. For those of you that wanted to know or find out from Chris, there is a list in the chat box of where he was getting his PPE. And I did also type those down as well. So are there any closing questions or comments? I mean, is this something that you guys would like to do again in the future? Has it been helpful?
I would like to, because I think things till this vaccine gets rolling are gonna get a little nuttier, as much as I hate to say it. It's great to know where to get stuff. McKesson, I didn't even think about that just because we're not a supplier, we're not a supply store, we're not, but I'm glad they're on the line. By the way, I need a 700-pound walker in 24 hours if you can get me one, call me. Just found that out through text. Sorry, kids, had to do a little business. I think it's great. I've learned a lot from Dan Dan through these, and it's nice meeting people that's going through the same stuff that are in positions that have to make decisions. So I personally really enjoy it.
I agree. This was good for me as well. So helped me feel better that I'm not the only one that has these problems. So
we're all in this together, Mr. Henry.
Yeah, I know. I thought I was on the island. I didn't know for sure.
You're on the big island now. About a month. You're in the big money island.
Oh my God.
When you like to get some of that 200 billion or whatever they paid.
Yeah, 2.1 billion.
I mean 2.1 million. I can tell you, I'd be skedaddling out here pretty quick. Yeah. A billion. I would skedaddle too, but yeah.
Yeah.
I agree. I'd like to for this to continue, and I've got some, as far as like COVID screening for your employees. It's a pretty hefty screening guideline, but Rose, I can send that to you if you want to share that.
Sure.
And you can kind of see what Freeman Health is doing.
Okay, perfect.
For the tax credit, Craig, do we just like tell your accountants, because we haven't had it, like when I get to stuff, it's kind of, I'm one of those people just kind of wait till, oh, it happened, gotta get this done. Tax credit on the employees, just show our account how much we spent on COVID. I mean, how do you get the tax credit next year? Just add up all the hours on the people that were sick, or? I think he's gone. Okay, I'll figure it out.
I sent you information from the CDC. They kind of give you guidelines on the tax.
Okay, thank you. And I know
your CPA or your guy is going to be the
They'll know.
very well there, because everybody's going to have the issue.
Well, I've been calling Craig a lot for that provider relief fund money. He's guaranteed to hear from me again, because now you got to report, because you want to make sure you're not double dipping into the other money.
Well, that's why he's on mute.
Yeah.
And
I'm
Dan,
here. I had to grab another call, but call me if you need something on that. All right, Karen?
I've already, my text is already rolling at you.
All right, very good.
and Dan, I think you were trying to say something.
No, I was just gonna, I was gonna chime in. You know, I've been kind of quiet just because what we do is dramatically different day to day, and I kind of have been awakened to the challenges that you guys all face. So know that I have empathy, and I think the challenges in understanding how working with COVID positive patients and getting access to nursing homes and all the things that were talked about today were kind of eye opening. And we're kind of in our own little bubble. All of our employees are remote. We moved them all remote last March, April. So customer service and billing all are working from home, which has kept their morale pretty positive. In terms of frontline, our respiratory therapists, and there has been some morale issues. We just tried to be as responsive and have calls and support and text and take care of those issues as they come up. I know our ownership has had some dinners sent to the whole company for everyone's family, so that they could have a couple of nights throughout the course of this where they didn't have to worry about dinner. I know there's
A great idea.
Yeah, a little Christmas bonus for the company, but in terms of our focus is pediatric complex respiratory care. So those patients are coming out of children's hospitals, and our respiratory therapists are working with them. And I know that we've only had one employee who was COVID positive, and I also am uncertain if we've even worked with a COVID patient in the community. I'm actually trying to figure that out, and for tomorrow's Wisconsin call, I hope to have that answer. So our challenges, usually I have a lot to say, but our challenges are a little different than everybody on the line here. So I sympathize, empathize, and I appreciate what you guys are doing on the front lines to help so many people.
Well, thank you. Thank you. All right. Well, that concludes our session. Any last comments, Ms. Karen Atkins?
No, it's nice talking to y'all. Can't wait to have some beers with you.
All right.
I'm hoping in the spring we will have a MAMES.
It's not
We'll
looking.
see. It's not looking good, is it?
Yeah, it's not looking good. All right. Well, thank you, everybody. Appreciate your time. And we will talk again soon. I'll work with Karen and the Missouri board members to get another one scheduled, hopefully maybe in the next couple of months. So thanks all.
Thanks, guys.
Take care.
Thank you.